Welcome to our channel. I am Shaira Cohen. I am a certified nurse practitioner, nurse educator, and the CEO of the Cohen Review. But most importantly, what I want you to know is that I have dedicated my entire career in crafting the best online course for nurses like yourself who are preparing to take the board exams, regardless if you're preparing for the AANP or the ANCC. Today, I would like to show you some question samples like the ones that you may see on the exam that I have carefully chosen from my extensive question bank. And these questions may mimic what you may see on the exam. So my purpose today is to give you invaluable exam tips to analyze these questions so that you are prepared when you sit for the boards and you don't fall for the tricks. Are you ready? Let's get started. 3 important tips. First, to avoid falling into traps, carefully assess the details provided. What do I mean by that? Well, for example, watch out for negative words in the question, such as not, accept, and reject. Also, irrelevance. Sometimes the questions have distractors. It's extra material that you don't need to answer the question, but it is your job to recognize these distractors and not get thrown off. And yes, the Cohen Review does a really good job at making sure that you catch these so you don't fall for them. Also, correct or incorrect answers. Be aware that sometimes the answer choices may have relevance to what the question is talking about, but won't answer the question itself. So it is your job to recognize what is truly being asked in the question so that you recognize the correct answer and you don't fall for that. Also, be aware of emergent situations. That's tip number 2. Remember, you are being trained for primary care settings. Now, you will encounter emergent situations, but you won't be able to handle them in your primary care setting, and you shouldn't. The Nurse Practitioner Boards are huge at making sure you recognize emergent situations such as heart attacks, ectopic pregnancies, or closed-angle glaucoma, and to know exactly what to do next. And most of the time is to refer them out. But watch out for those. And yes, we do go over in the Cohen Review and we point these out clearly to you. Also, number 3 is build confidence in pharmacology. I know. It is students' most dreadful topic to study. Why? Because it requires so much memorization. But I have created lectures in pharmacology specific, narrowing it down to what you need to know so it doesn't become overwhelming. And I do a really good job at explaining the pharmacokinetics, because if you understand how things work, you will remember the material a lot better. And yes, we do have a link in the comments below where you can watch a preview to that pharmacology lecture. Now, in the next slide, I would like to show you some questions and their answer choices, and together we will analyze the question and explore why the correct answer is what it is. You're welcome to pause the video if you need a little extra time, but I'm ready, and I hope you are as well. Let's get started. The first question reads, what is the most commonly diagnosed cancer in both males and females? A, lung cancer. B, pancreatic cancer. C, skin cancer. Or D, rectal cancer. Now, this is a straightforward knowledge content question, but if you're rushing on the exam or if you read this too quickly, you may actually choose the wrong answer. We'll talk about this, but let's review the correct answer. The correct answer is C, skin cancer. Let's analyze the question together. It asks for the cancer that occurs most commonly in both sexes, and that is skin cancer, specifically basal cell carcinoma, which gets removed and the patient moves on with their life cancer-free. But I bet some of you liked the answer lung cancer, which is A. Well, here's what's going on. The question is asking most commonly diagnosed. It's not asking for death-causing cancer. If that was the case, then clearly lung cancer is the most common cancer that kills both men and women. but that's not what the question is asking. So make sure you slow down on the exam and that you catch these things so you don't choose the wrong answer. As for the other cancers, colorectal or colon cancer is the second most common. Pancreatic is the third. All right. FYI, I do have a blog specific on cancers, which I highly recommend that you watch. Not only that blog, but all the other blogs, because it's beneficial content for your preparation for the exams. And yes, it is free to everybody. So again, in the comments below, click the link to watch our free blogs. Question number 2. A 62-year-old female presents to the clinic with 20 pounds of unintentional weight loss, abdominal bloating and pain, vaginal bleeding, and generalized malaise. Which of the following would be the best initial test? A. MRI of the abdomen and pelvis. B. Pelvic ultrasound. C. PET scan. Or D. Abdominal X-ray. The correct answer is B, a pelvic ultrasound. Now, let's look at the entire picture first. We have a post-menopausal female, because nobody has their period at the age of 62, or nobody should, right? Who presents with unintentional weight loss. That's not good. That alone is a red flag for cancer in the most part. Abdominal bloating and pain, something going on in there that shouldn't. There's bleeding. She shouldn't be bleeding vaginally. And she has this generalized malaise. Now, the question asks, which imaging test will you order next? Well, this screams ovarian cancer, and your job is to screen appropriately. As to all of the answers provided, pelvic ultrasound is the best answer because it is quick, it's inexpensive, and it gives you very good information. An MRI of the abdomen and pelvis or a PET scan, these are very, very expensive tests. And she probably will have these, but later. Let's first do a pelvic ultrasound to assess what's going on. And abdominal x-rays. X-rays are great, but pelvic ultrasound does a better job at assessing masses versus an x-ray, which is really good at assessing bones or air spaces like the lungs. Now, remember tip number 2? We talked about emergent situations. Yes, this is an emergency. There's some kind of cancer going on. But first, let's assess thoroughly. Anyways, the question asks, what imaging will you order? Not what would be your next step. And out of the choices provided, pelvic ultrasound is the best because you want to assess for ovarian cancer, which, by the way, it is the most deadly gynecological neoplasm in the United States. Question number 3. You should advise your patient to avoid blank while taking warfarin. A, tomatoes. B, mussels. C, broccoli. Or D, oranges. The correct answer is C, broccoli. And this is a pharmacology question. You have to be very, very aware of certain pharmacokinetics. Warfarin is one of those drugs that you need to prepare for the exam. And patient education when they're on warfarin should include the avoidance of green leafy vegetables because these are rich in vitamin K. And vitamin K can prolong PT and INR, and this can put the patient at a higher risk of clots, making the warfarin also less effective. But let's analyze the question. This type of question requires knowledge on how warfarin works. And again, pharmacology can be challenging, but if you know what you are studying, if you know what to study, if you are provided with the content to study, it's going to become a lot easier. And that's exactly what the Cohen review does. It makes you focus on the drugs that you need to know, the mechanisms of actions that you need to know, the most relevant side effects, not all of them, not the entire laundry list. You don't need that for the exam. And I welcome you to check out a pharmacology preview of my lecture by clicking in the comments below. So check that out. Thank you for watching our video on the breakdown of questions for the NP boards. I hope that the strategies and the tips will not only assist you in passing the nurse practitioner boards, but you also find them helpful for future exams. For additional resources to help you with the NP board's preparation, I welcome you to check out my website at www.thecohenreview.com. Certainly don't forget to subscribe to our YouTube channel, which has plenty of free material and invaluable study aids. I wish you the best of luck with this journey. Thank you.